The latest news, updates, and more from the world of health and medicine. This is Medical Minutes with Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. Is it possible to get the coronavirus even after being vaccinated? Well, the answer is yes. Health experts are referring to these patients as breakthrough cases. So why is this happening? In this week's episode, we spoke with Dr. Paul Driscoll, medical director for Franciscan Physician Network, to get some answers. Our conversation is next. Joining us now is Dr. Paul Driscoll from Franciscan Health. He is here to talk about a really interesting term that doctors are talking about, breakthrough COVID-19 cases. So welcome. Thanks for being here.
Well, thanks for having me.
So first question is, why such a thing as breakthrough cases? Who do these people represent, first off?
Well, first of all, you have to realize that these are very uncommon. And breakthrough cases are actually to be expected because the vaccine, although they're extremely effective, they're not 100% effective. None of them are. The most effective, the Moderna and the Pfizer vaccines are about 90% people, even after being vaccinated, can become infected.
So you're saying that even do we know? So even the Moderna, the Pfizer, and the Johnson & Johnson, these are three, even though because they are not 100% effective, there's always that chance that someone even getting a vaccine could become reinfected.
Yes, that's correct.
And then do we know, the number of cases is low, but I know that also, well, let's say, right, it's not these vaccines aren't 100% effective. They're very high. However, I'm wondering if there's a certain population, people with lower immunity that don't have these T cells, antibodies to, high enough levels to begin with, maybe not have sort of a more robust response. Other vulnerable populations. Anyone that you could think of that this might affect more than other people?
Well, right now there are too few cases of breakthrough to really know that. One would suspect that it could be people who might have been immunosuppressed for whatever other reason, not have as good an immune response, but there just haven't been enough cases of this to really be able to parse out any specific reason why breakthrough occurs. I'm sorry,
I lost you just for a second. Could you say that again? Why?
Okay.
You don't know, but like people with lower immune systems, you were saying, and can we give some examples of people who might have lower immune systems?
Sure. Yes, there's certainly a possibility that someone who has an impaired immune system, someone who perhaps is undergoing cancer chemotherapy or may have an immune system disorder, might not mount as good an antibody response to the vaccine. But they said there haven't been enough cases to really tell this up to this point.
And I'm wondering if it's not that common, and we probably don't even know, there's not enough cases, we probably don't even know yet if a specific vaccine, they're saying across the board that people are like, which one's more effective? Well, essentially the message is they're all the same, without being the same. I don't know, what are your thoughts on that?
Well, the studies that we really have looking at breakthrough are pretty much based on the Pfizer and Moderna vaccines because the Johnson & Johnson hasn't been out that long. There does not appear to be any significant difference between those two.
And I'm thinking that infection occurs, from what I read, the latest statistics that I read is that after vaccination, between 1 and 14 days is the most after the last dose or the first dose, whatever vaccine that you're getting, 1 to 14 days afterwards is the most, is that time where you can get reinfected. And I'm wondering if there should be more messages that people, it's not, you really need to take precaution, you could still get infected. Maybe another reason or another sort of population that might not be following maybe masking or social distancing. What are your thoughts on that?
Well, we are trying to inform people when they become vaccinated that they don't get the maximum response until 2 weeks after either the second vaccine or the first vaccine in a one vaccine regimen. And that is very true. Once you get past 14 days, the numbers of reinfections are extremely low. And it does mean that that's another reason why we should continue with our masking and social distancing and hand washing until we get the total number of people in the population immunized, that becomes less of a concern.
Mm-hmm. And well, Dr. Driscoll, just one, I want to get your thoughts on this. I was speaking with the doctor the other day, and she was saying Indiana is officially in its fourth wave. Just, can I get your thoughts on that, just briefly, how we're doing in Indiana?
Well, right now we're actually doing pretty well. Yes, there has been an uptick in cases, and we think that's probably due to the emergence of the variants, especially the variant that originated in the UK. But because we have already immunized a large number of our most vulnerable population, especially the elderly, the cases that we are seeing are milder disease, not requiring near as much in the way of ventilatory support.
Well, anything else you'd like to add in terms of these breakthrough cases, what people can do as we continue to sort of work through this and get sort of on the other side, having the world right itself again? Last 30 seconds.
Yes, well, I think the most important thing for people to realize is that the vaccine is not a force field around you. It's still possible to be exposed to the virus and to become infected. It's a very low chance of that if you're fully immunized. But for that reason, again, we need to continue with masking, social distancing, and hand washing until we get a large proportion of the population immunized.
Mm-hmm. Oh, I like the way you put that. Would you say a force field or?
Yeah, that was something one of our infectious disease doctors says, how she put it out to us, is that it's, it protects you, but it's not a force field around you.
Mm-hmm. Yeah, and I remember I was speaking to another doctor, infectious disease expert, and she was saying the same thing. People are coming. I'm always really interested to sort of go out on the street and just ask people how they feel after they get vaccinated. And I'm super psyched. I'm a week from Saturday, I'll get my first shot. And she was saying it's people were calling it the freedom shot. That's what I've been kind of hearing just around. And she was saying it's not really a freedom shot. It's the freedom of fear shot, let's say, to start out with, because I just do think it does provide a sense of relief in terms of everybody that I've been speaking to, given this past year.
Yeah.
What do you think?
I agree with that 100%. I mean, it's the best way for us to emerge from this pandemic. I know a lot of people have been deciding what activities they think they can begin doing when, based on that. I can even take my own example. My wife and I, we've got 4 grandchildren that we hadn't seen for almost a year, and she counted down the time till it was 14 days after her second vaccine before we made our first trip to see them. So.
Well, yeah, it's like Christmas is coming. Like when you're like you're a 5-year-old, and I remember just speaking to a woman, and her shot was like 7 o'clock at night, but she was up and ready at 7 in the morning, just in case someone they had an opening. And I was just like, oh my gosh, Wanda, that's so great. But anyway, just one last question, just because we're talking about this. Someone can't get the vaccine again if they're a breakthrough case. That's probably something there's not enough research out there. I'm just curious as sort of my brain goes thinking about this. If they're a breakthrough case, they get reinfected. I mean, I don't know.
I have not seen any guidance on that at this point.
Right.
I think there is a thought that we may very well need boosters a year from now or so. And so someone who's been reinfected and had breakthrough might qualify for a booster a little bit earlier, but that's just conjecture on my part. I've not seen any official recommendations about that.
Yeah, right. Just we're learning something new about this every hour, if not every minute, every second. Well, Dr. Driscoll, so great to see you. Thank you again for your time.
Great. Very nice to talk to you again. Thanks.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
Learn more and get more with Wish TV. Online at wishtv.com and when you follow Wish TV on Facebook. Be sure to check out more great podcasts from the All Indiana Podcast Network now at allindianapodcastnetwork.com.